Hello, my name is Miranda Cox, and for this presentation I chose to do Munchausen syndrome. So, what is Munchausen syndrome? Well, there are actually two different types within the syndrome. There's the main type, which is actually called Munchausen syndrome, where you fabricate injury or illness to yourself. And there's the closely related Munchausen's by proxy syndrome, which is where you fabricate injury or illness to someone in your care. And this is typically seen in a parent-child relationship, but can be seen in other caregiving relationships as well. And perhaps the most famous case of Munchausen's by proxy that you may have heard of is the case of Dee Dee and Gypsy Blanchard, whose picture you can see in the lower right-hand corner. Both Munchausen's and Munchausen's by proxy syndrome are extremely rare. The term Munchausen syndrome was first coined by Dr. Richard Allen John Asher in 1951 and was named after Hermanus Karl Friedrich Fredvar von Munchausen, aka Baron von Munchausen, who was an 18th century storyteller known for his wild retellings of his exaggerated exploits. It was named this because those with this syndrome often lie about or embellish their symptoms in the same way that Baron von Munchausen exaggerated his stories. Munchausen's typically presents itself in adulthood and is usually identified through multiple atypical symptoms that are not supported by clinical examinations. These individuals tend to have a history of healthcare services with unsuccessful treatment and have no basis for underlying presenting symptoms, and the symptoms can sometimes be questionable. These individuals are also unusually educated in medical knowledge. Some red flags that occur in individuals that may have Munchausen's are an unusual presentation of symptoms that are unresponsive to treatment, and when symptoms are resolved, new ones can appear. They may have multiple drug allergies and few visitors in an inpatient setting, and an extensive medical history not supported by diagnosis or medical procedure. With Munchausen's by proxy, the caregiver is never satisfied with treatment or expresses relief when the patient's condition improves, and the symptoms are atypical and appear when the caregiver is present. Siblings of the victim may also have unusual symptoms. Like Munchausen's syndrome, the victims of Munchausen's by proxy syndrome tend to have symptoms that are not supported by medical findings and may not respond to treatment and have inconsistent medical histories. It is important to note Munchausen's is extremely rare, so even if someone has some of the red flags, it doesn't mean that they have Munchausen syndrome. If a physician suspects Munchausen's, a psychiatric evaluation is needed. Once someone is diagnosed with Munchausen's, counseling is the best treatment that they have currently. With Munchausen's by proxy, family counseling may also be needed. In counseling, those with Munchausen's work with their counselor to address their concerns with their condition and their underlying motivation. Oftentimes, those with Munchausen's developed it because they had a family member who was chronically ill and received attention, and they, in turn, felt abandoned, and because of that, they tend to mimic their symptoms to get attention. In counseling, the best approach is to learn how to manage the symptoms, develop healthy coping mechanisms, and recognize when they engage in Munchausen symptoms to prevent it from recurring. The goal currently is not to cure it, but to learn how to manage their symptoms. Again, Munchausen's is extremely rare, so it's not likely that someone is to have it, but if they do have it, it is important to treat the individual with compassion and address their concerns instead of just accusing them of things.